Alright, so here we are with the third and final video for class, and this is the muscle section. And in your pre-lab, you're going to notice you have a section for origin, which is the proximal attachment, insertion, which is the distal attachment, and trace. And trace is simply the direction that the muscle takes, superior, inferior, medial, lateral, etc. We are not going to worry about innervations, but understand if you're going to go to graduate school, you're going to take an anatomy course at grad school, they're going to want you to know innervations. So if you are making up flashcards or if you're just going to be learning these muscles, learning innervations at this point certainly can't hurt you at all. So when we go for each of the muscles, we're going to work on palpating them and locating them. And you have to understand that because muscles contract, the easiest way to find a muscle is to have it contract. So you're going to notice in your trail guide, it has a section called action, which is what the muscle does. So if you resist the action, the muscle becomes prominent and makes it easier to palpate. And we'll do that when we start our labs on Friday. So really the muscles of the axial skeleton, and by axial I mean the spine, the head, etc. The appendicular skeleton are your extremities. So the axial skeleton, these are responsible for your facial motions, your eye motions, tongue, neck, etc. So they are the central muscles in your body. And some of these we can't palpate, some of these we really can't see very well clinically. Your facial muscles, very, very well developed, highly vascularized, and they do a whole bunch of fine motor and fine motor functions and motions. So we're not going to spend a ton of time on facial muscles because they're very hard to palpate and very hard to see. We're going to be doing more of the larger skeletal type muscles. But for mastication purposes, our mastication muscles, which are chewing muscles, we're going to talk about the first two being the temporalis and the masseter. Don't worry too much about the lateral pterygoid. Even though it is a mastication muscle, we're going to spend most of our time with temporalis and the masseter. So the first one is the temporalis, and as the name implies, it originates in the temporal fossa from the temporal bone. From here, it actually travels underneath the zygomatic arch, which is located right here, made up of the zygomatic bone and the temporal bone, and actually inserts right in here into the mandible. And you're going to notice your trail guide is going to have a very specific insertion for this, so please make sure you understand that this specific bony landmark on the mandible. I'm not going to tell you right now because I want to make sure you look it up and find it, but this muscle is basically in charge of chewing and clenching. So if you actually palpate just proximal or just superior to the zygomatic arch and you come into this temporal fossa and you chew, you can actually feel the muscle contracting, relaxing, contracting, relaxing. This is temporalis muscle, one of the two muscles we talk about for mastication. The second one is the masseter, and the masseter muscle is very, very strong given its size, and it's running right here from the zygomatic arch, almost in a straight inferior direction, right basically down into the ramus angle and body of the mandible. So if you clench your jaw, you can definitely feel the masseter contract. So between the temporalis located here and the masseter, we have some very, very strong muscles which aid us in mastication and chewing. Moving into our smaller muscles, you have ocular muscles, and again, we can't palpate this. This is inside the orbit of the eye, so your eye is actually sitting right here, so we can't palpate it. In the previous video, we talked about the apex. That's the apex right back there. You have your four rectus, superior, inferior, medial, and lateral rectus musculature, plus an inferior and a superior oblique muscles. And what these muscles do, they allow the eyeball to look up, look down, look right, look left, and actually kind of rotate too. So again, we're not going to palpate them, but understand that just within the eye, you have 6 little muscles to control all of your motions that the eye can do. Now we're going to get more into the neck muscles, where we classically think of when we think of the musculature. They support the head, and they act as a major attachment point for a lot of the structures of the neck. And our main ones are the Sternocleidomastoid, Trapezius, the scalenes, anterior, medial, and posterior, and Levator Scapulae. We're going to talk about each of these a little bit more. So the first one is Sternocleidomastoid, huge muscle, easily palpable, easily visible, and it's basically running, as its name implies, from the sternum and the cleidoid, or the clavicle, up to the mastoid. It actually, this is the one area where it's reversed, because its origin is actually distal and its insertion is actually proximal. So its actual origin is down here on the sternum and the clavicle, and it travels superiorly and inserts up here into the mastoid. And the easiest way to find it, if you're going to palpate your right sternocleidomastoid, is to do lateral flexion to the ipsilateral side. So drop your right ear to your right shoulder, and then you rotate to the contralateral side. So rotate to the left, and if you palpate, you can actually see and feel your sternocleidomastoid muscle come out. Very, very strong muscle, very, very powerful, and we'll be able to palpate that quite easily on Friday. The trapezius actually has 3 sections based on the orientation of the fibers. You can kind of see right here, the upper fibers are sort of in a vertical arrangement, the middle fibers are almost pure horizontal, and the lower fibers are in another vertical arrangement. So we're going to talk mostly about the upper fibers right here. Its origin coming from the scapula, from the clavicle, etc. Actually, the very broad origin, traces superiorly and inserts back here into the occiput. There's that superior nuchal lines and the external occipital protuberance. So this is the upper trap. Its main function is going to be the shoulder shrug, and you can easily palpate, actually maybe visibly see someone with very large upper trapezius muscles. You actually see this angle right here quite predominantly. The scalenes, very, very small muscles, and they actually run from the vertebrae, right in here. They actually pass underneath the ribs, underneath the clavicle, and insert into the ribs. Sorry, so this is the clavicle bone right here, and these muscles actually pass deep to it and insert here in the ribs. Sternocleidomastoid is cut away here. It should be right here. So you can see there's the sternum and the clavicle, there's the mastoid. So sternocleidomastoid should actually be right here. So what we do is we palpate sternocleidomastoid because it's so easy. We drop slightly posterior and we can get into this soft spot, and here are the scalenes. Because they insert into the upper ribs, what you have your patient do is actually take a very deep breath, trying to lift their upper chest, and they try to lift their upper ribs, and these muscles will contract, and you can actually palpate the scalene. So if you have someone take a deep breath and trying to expand their upper rib cage, you actually can palpate these scalenes posterior to the sternocleidomastoid. Don't worry about trying to differentiate anterior, middle, or posterior. Yes, they are 3 distinct and separate muscles, but for our purposes, we're just going to palpate the scalenes as a group. And the final muscle is Levator Scapulae, and this is like the epitome of being a lazy anatomist. It does exactly what its name says. It elevates the scapula. It actually inserts right here in the superior angle of the scapula, runs superiorly, and comes up and inserts into the skull, into the vertebrae. Really, the only place we can palpate is going to be right here for a little bit at the superior angle, because cut away is the upper trapezius muscle. So the upper trapezius muscle would be right here, running superficial to it, so it actually covers Levator Scapulae. So we won't get a great palpation on it, but we know that it runs in this direction, and upper trapezius is going to be running right here. You're going to see we have a lot of other musculature, which we haven't talked about yet, but those are going to be your 4 main muscles that we're going to palpate on Friday. So please make sure you come Friday knowing the origins, the insertions, and the basic trace of the muscles, and we'll get right to palpating.